India's elder care crisis meets the gig economy, why 200 million caregivers may be. That single number resets the innovation playbook. The key question is not what happened, but what changes next for operators and users. We will map trigger, incentive shift, and downstream impact before the close. That's the entire population of the United States. Right now, India has 140 million elderly citizens. In 24 years, that number doubles. The ratio of working-age adults to elderly collapses from 10 to 1 down to 4 to 1. Here's what nobody's talking about: India can't even pay factory workers in Noida on time. So how is it going to build hospitals for 180 million additional elderly citizens? The answer? It's not going to. And that's actually the opportunity. India's healthcare infrastructure is already broken. 1.3 hospital beds per 1,000 people. The World Health Organization says you need 3 to 5. To close that gap, India would need 2 million additional beds. That's 20,000 new hospitals at 500 crore rupees each. 100 lakh crore rupees. $1.2 trillion. It's not happening. But here's the hidden story: 200 to 250 million Indian women are already doing elder care work. Right now. In homes across the country. Daughters-in-law. Hired domestic help. Providing 24/7 care with zero formal training, zero employment protections, and zero recognition in the GDP. Economists estimate this unpaid care work is worth 10 to 15% of GDP if you priced it at minimum wage. That's roughly 10 lakh crore rupees. $120 billion. Just sitting there. Invisible. Uncompensated. Untapped. Now compare this to what's happening right now in Noida. Garment workers. Electronics workers. Predominantly young. Increasingly mobile. Refusing to accept exploitative conditions. Demanding wage hikes they're not getting. These workers represent the old industrial model. The new model? It's caregiving. Professionalized. With dignity. With training. With fair compensation. Japan spent 25 years building its elder care system. It hit 14% elderly population in 1994. India hits that same threshold in 2030. That's 4 years from now. And India currently has 1/10 the per capita care infrastructure Japan had at the same stage. But elderly care isn't primarily a medical problem. It's a chronic condition management problem. A daily living assistance problem. A 75-year-old with diabetes and limited mobility doesn't need a hospital bed. They need someone to help with insulin dosing, meal prep, mobility, companionship. Japan proved this decades ago. 80% of elder care happens at home or in community settings, supported by trained care workers. Not hospitals. Communities. So here's where it gets interesting. India needs 15 to 20 million trained care workers by 2035 to maintain even a 15 to 1 patient-caregiver ratio. The National Skill Development Corporation currently reaches fewer than 50,000 people annually in healthcare assistance training. The gap is massive. But the workforce already exists. It just needs formalization. Think about the economics. Care work, if professionalized with 15,000 to 25,000 rupees monthly wages, competitive with factory work, plus training and career progression, could absorb millions into stable employment. Young workers rejecting manufacturing can move into care. Dignity. Stability. Growth. The ripple effects multiply. India's health tech sector raised $2.7 billion in 2024 and 2025. 90% went to telemedicine and diagnostics. The real market is elder care management platforms. Coordinating home health aides. Monitoring chronic conditions via IoT devices. Integrating with family caregivers. Israel's CarePredict does wearable fall detection. Singapore's Homage runs a care marketplace. India has the tech talent and the cost advantage. What's missing? Policy clarity on worker classification and insurance reimbursement for home-based care. Here's the wild card. If India trains 5 million certified elder care workers by 2030, it creates a global export workforce. Japan needs 400,000 foreign care workers by 2035. South Korea, Taiwan, Singapore, all facing identical demographic crunches. Filipino care workers currently dominate this market, earning $15,000 to $30,000 annually in developed economies. India's advantage? English proficiency, cultural adaptability, scale. So what's the timeline? India's 2026 union budget is the inflection point. That's 8 months away. What needs to happen? Formal occupational status for care workers with social security coverage. A 5,000 crore rupee national elder care training fund targeting 500,000 certifications in year 1. An insurance mandate requiring coverage for home-based care. Currently only hospital stays get covered. A regulatory sandbox for care coordination platforms in 10 cities. The contrast with the Noida wage crisis is instructive. India can't even execute payroll for existing industrial workers on time. Building a new elder care system requires building entirely new administrative capability. Not just scaling an old one. But the payoff is enormous. A 10 lakh crore rupee domestic industry. A global workforce export at scale.